Good evening, everyone. My name is Alex Marshall, and I'm one of the admissions advisors here at Utica College. We want to welcome everyone to our virtual open house this evening and thank everyone for attending. We're excited about today's webinar as we discuss why healthcare needs more cybersecurity professionals. And we have our director of the program, Dr. Leslie Corbo, here today that will go over a lot of interesting topics that we feel that you will be very excited about. She'll go into the presentation this evening. If there's any questions you have, just type them right into the Q&A box, and I'll try to get to those, as many of those questions as I can, and we'll present the questions to Dr. Corbo at the very end. And at around that time, we'll wrap up with a little bit more of Q&A. And if there's some questions that we're unable to get to at that point, you can always feel free to reach out to your admissions advisor or contact us here, and we'll have the information at the end as well to service your needs. So without further ado, I'd like to introduce Dr. Leslie Corbo. Take it away.
Hi, everybody. So tonight what I wanted to go through was something that I've done a lot of research on over the past, oh my gosh, I think I started doing this research project in 2014. And some of the research comes from my actual doctoral dissertation when I defended that, but a lot of the research comes from the article that I had, the research study that was published in the Journal of the American Medical Association. And they believe that I may be one of the only cybersecurity professors that has ever been published there. So I take that as a really big, to me, that's a really big deal because cybersecurity to me is, you know, like, and probably to you all is something that's really important, probably the most important thing that we have. So I titled this, you know, why healthcare needs more cybersecurity professionals. And one of the things that I wanted to talk a little bit about, we'll go through this really quickly, but thinking and phishing. So if you have this brain teaser where Mary's father has 5 daughters and their names are Nana, Nini, Nai, Nono, what's the name of the 5th daughter? Now, most of us look at that and we go to Nunu. And even if you didn't think that, even if you've already seen or heard this before, the 5th daughter is Mary. But the way that our brains work is kind of interesting, and this is where some of I call these cross-departmental ideas and research, because when I'm looking at this, you know, we spend 95% of our brain in the limbic portion, where we're just doing unconscious processing. You know, this is where things are emotional. We associate things with it. We only spend 5% of our brain in the analytical side, in the neocortex, where we're deliberately doing something. We're processing. We're looking at things analytically and rationally. We could not spend our life in the opposite way. We just couldn't do it. Nothing would ever get done. We'd never be able to make a decision. We'd never be able to do anything. So the system 1 and 2 way of thinking is an interesting way to look at a phishing email, because when you're looking at a phishing email, it might look real and you just automatically follow the directions. And that brings me to this. This is what people traditionally think of the internet as. There's your system, and you've got this moat around it, your firewall, and you've got, you know, your one way coming in and out, and it's you know, as long as you're protected by that moat to where nobody can get in, you're fine. But this is what the internet really is. The internet is a dirty, disgusting, vile place. One of the attorneys that I recently worked with on some research, he called it a place full of virtually transmitted diseases. He called them VTDs. And this is what the real internet is. It's a dirty, evil place. And our end users need to be protected. And that's where cybersecurity comes in. We're protecting the data and the people who are using the internet. So that brings me to, I always like to put this part in because the workplace is changing. First of all, we're all working from home, or the majority of us are working from home. I'm very fortunate to be still working on campus at Utica College. You know, we're very, our COVID rate is extraordinarily low. But most colleges around me are closing and people are working virtually. A lot of the people I know are only going into the office maybe 1 or 2 days a week, if they go in at all. So the workplace is changing. And when I used to work in incident response, I would always be doing a post-mortem with the chief information officer and the chief information security officer and other ISOs. And what they'd always say in one form or another is that once the older people retire, we won't have to worry about, you know, people clicking on the phishing emails and that kind of thing. And that I used as the basis of my research, because I always thought that was interesting that people thought, you know what, once the younger people are in here, everything's going to be great. Well, that's not necessarily true. So so some of the research that I did found that millennials are actually unintentional insider threats. They're tech savvy, but they're not necessarily security conscious. And a lot of times what we do is we think about things as far as, you know, if somebody's tech savvy, we think they know everything there is to know about information security and cybersecurity and that kind of thing. And that's not true. However, with a millennial, their technical aptitude is really affecting how organizations use and purchase technology. And one of the big things that everybody's doing right now is, you know, the bring your own device. And with BYOD, there's a lot of risk. There's a lot of risk with somebody bringing their own device in. So there's different ways, and a lot of organizations have become really good at figuring out how to secure it and how to secure those devices that may be connecting to the internet. Because if any of you are even close to my age, you know that the stuff that they issue us at work is garbage. We want our own things, right? So that's one of the things that I always like to point that out, that, you know, we have these, you know, we want to be able to use our things, but in return, we need to allow the organization to really secure them. And that's part of, you know, what we do as cybersecurity analysts and information security analysts. Millennials are expressive, so they're 2.5 times more likely to adopt technology. They also use the internet to broadcast their thoughts and to contribute content. And one of the things I always recommend when I'm working with organizations is, do you have a social media policy? Because you want to make sure that your employees know that they can't put things online that contradict the mission of the organization. They shouldn't put things online that may reflect something that the organization does not want them to reflect. They're also fearless about talking about, you know, some of the people they work with and that sort of thing. But the really cool thing is that over 60% of content online, and I think this is up to like close to 70% now, was produced and uploaded by a millennial. So we have millennials to thank for a lot of our online content. So in 2017, I participated in this study with Raytheon and ForcePoint and the NCSA, the National Cybersecurity Alliance. And what we found with millennials was that millennials they'll connect to Wi-Fi with no password. That means at an airport, that kind of thing. Over 3/4 of the time, they admitted, yeah, 3/4 of the people in the study said, yeah, once in a while, you know, if I'm at the airport or if I'm at a cafe or if I'm someplace, I'm going to be connecting to the public Wi-Fi with no password. Almost half of them admitted to sharing passwords with non-family members at one time or another. And this is what I didn't find shocking. Now, I'll tell you, my kids are millennials. I have 3 of them, and they're millennials. And this is so true of my millennials. Almost 90% of them thought they were really good at protecting smartphones and computers. So they're willing to connect to Wi-Fi with no password, and sometimes they share passwords, but almost all of them think they're great at protecting smartphones and computers. So I always found that part of the study really interesting. But now what we have is Generation Z. Gen Z has never known, they never knew what a flip phone was. They've seen it maybe in TV or on The Office or something like that, but they've never known life without a smartphone. They require information on demand. If any of you are, you know, I keep going back to the people, I never wanted to be that person who said, back in my day when we had to go to the library and you know, use the card catalog and like look at an article on microfiche to see if it was even something that we could use. Gen Z has never known that. They require information on demand. They're very willing to take the very first thing that comes up on a Google search. And for those of you who've ever done any research at all, you know that can really be a problem. They trust their friends and even strangers more than they trust an authority figure. So if your friend tells you that something's true or not, they really don't pay attention to that. They have a higher level of self-direction and purpose. And they're looking at things, and it's all based on the way something makes them feel. So when I did my dissertation study, I did it on, I tested Generation Z. And what I found was that they talked about how something made them feel when they looked at it. They didn't always examine a clue in an email. And the deception indicators, that's what I call things like the hyperlink that's being redirected, or who the sender is, or the email header itself, or the lack of branding. If in one email I used the colors of Amazon, and I did it to where it looked like what Amazon sends you after you order something. And I just used Amazon's branding colors. I didn't use Amazon's logo or anything like that. And it was amazing to me that over half of them thought that, yeah, this is absolutely a real email. This is absolutely not a phishing email. So they rely on what I call visceral triggers. They go back in their mind and they look at things that, oh, that looks real to me. I've seen that before. It's familiar. It's all about their feelings. So this is one of my favorite cartoons of all time. It was it was created by John Klossner, and John Klossner actually was a Utica College student back in the late 80s. So I contacted him, and he said, you know, anytime you're ever going to use the cartoon, as long as you're using it for Utica College purposes, you can absolutely use it. So my very favorite cartoon. You know, in the one corner, you've got the firewalls and encryption and antivirus software, but in the other corner, you've got Dave, and Dave represents human error. And that's really, if you think about it, that is what information security and cybersecurity is all about. It's really, it's largely a people problem. It's largely a people problem. Um, we are responsible to make sure that the people understand how to protect the data as well. So this comes into how ransomware gets delivered. So if you look at it, this is just one. This is one variant of ransomware, but the attacker's sending the email, and it goes through the spam filter. It gets into the user's inbox. The user's going to click on that link. The antivirus won't pick it up, and the PowerShell runs. And what happens is it's going to, the code is going to connect to the attacker's command and control server. And that gives them the instructions and information that they need to encrypt the files on all of the drives. And after they've done that, the ransom note's delivered. And while that's happening, the attacker is moving across the enterprise. And something to think about is that ransomware works very slowly. So it's in there, and you may not know it. A lot of times it's being delivered on Friday afternoons and that kind of thing. So people don't really necessarily know that there's anything going on. Things are starting, you know, after hours and that kind of thing. So just looking at a few of the victims, that we look at this here as a business email compromise attack, where the email appeared to come from a senior staff member, and it requested information about some of the patients. Something that's really frightening to me is that a full medical report can sell for $1,000 on the dark net. So this attack happened, and the criminals made off with the names, dates of birth, medical information, medical insurance information, like their providers and ID numbers. Erie County was hit with something a little bit different. SamSam is more of a, it's looking for, you know, open ports and that kind of thing. But it hit Erie County Medical Center. And Erie County Medical Center is what they call a safety net hospital. And for those of you not familiar with it, safety net hospitals are those hospitals that anybody can go to, that needs treatment. No one will ask for insurance information and that kind of thing. They're also a level 1 trauma facility, so for adults. So hitting an organization like that is really difficult. They did this over, I think it started the Christian Palm Sunday holiday, and it targeted the center after business hours. It was using servers that were in Europe to launch the remote attack. Now, we don't have an extradition treaty with Iran, but we have charged, the U.S. has charged 2 Iranian men with the creation for writing the SamSam ransomware. But it's very unlikely that we will see them tried, because again, we have no extradition treaty with them. But this is what's kind of scary. So 30% of hospitals account for large data breaches. And that's a really big number. The estimated cost to healthcare companies by the end of 2020 because of security breaches, $6 trillion. Now, organizations don't lose that kind of money. That money gets transferred back to us in some way or another. Excuse me. And recently, I don't know if you've been following this in the news, but Universal Health Services has recently suffered the largest medical cyber attack in US history. They just got back up online after being offline for about 3 weeks. I'm researching a lot of the data with this just because it's, to me, this kind of stuff is really interesting and kind of exciting to watch. So I'll let this soak in for a minute. 24% of doctors are unable to identify common signs of malware. Either a phishing attack or a click here or a redirect, a watering hole phishing attack or something like that. So there's something too that I always like to point out. With physicians, it's very interesting to me that they, you know, about a quarter of them can't identify the signs of malware. I've worked with physicians a lot, and one of the things that they always tell me is like, you don't understand, we're really busy. We go from one patient to the next. We have all of this stuff to do, and we can't be bothered. And can't be bothered sometimes includes just typing in a 4 or 6 digit, you know, number for two-factor authentication to be turned on or something like that. So when almost a quarter of them are unable to identify a common sign of malware, that makes me, that keeps me awake at night wondering, like, who has access to my patient portal, right? So what I did was I worked with several physicians from Harvard. And what we did was we said, okay, let's look at phishing attacks against US healthcare institutions. And this was the largest study of its kind. We were, I think we looked at almost 3 million points of data. So we were looking at 3 million results. And what we did was we used healthcare institutions across the US. And we looked at data for from August of 2011 to April of 2018. And when I say 95 simulated campaigns, what we did was we took the data from 95 different email campaigns, the phishing email campaigns, the tests that hospitals run for compliance, to see if their employees and physicians and nurses and hospital staff will click on the link or open the attachment just to see what they do. So we looked at close to 3 million of these. And what we what we ended up doing was categorizing the emails. So we have 3 email categories. So one was office related. It was emails that said mandatory online workplace. We've got safety training coming up. You've received a new fax or a new document. You're expected to review this document on an annual basis. We would have to close they'd call them campaigns, but we would have to close them when it looked like it was coming from HR because the click rate was so high, they got nervous. So there's some things in here where that's where I believe some of the data was skewed, but the category of personal, those e-greeting cards, your new credit card's been shipped, you're receiving double rewards, and then the IT related things where your mailbox exceeded the storage limit, or your email account's going to be deleted, and if you receive this message, your email address is being queued for deactivation, those kinds of things. And what we found was overall, 1 in 7 emails were clicked on by employees. The overall click rate was 16.7%. The highest was anything that was IT related. So anything that had, I don't know if you can see my mouse, but anything that had something about how your mailbox is exceeding the limit, or your account's going to be deleted, or those kinds of things. Those things received the very highest click rates, and the thing that was lowest was the office related emails. So they didn't really fall for the ones that were, if you go back looking at mandatory online workplace safety training, and I think that that's by design, because I know that whenever we get that, we're like, oh, I'll look at it later, right? But and this I always like to put in like kind of fun facts. Most likely they were to click or open the attachment in the fall. They were least likely to click or open attachments in the summer. So in the fall, they were, in the summer they weren't. And this all goes back to some of the things that are unique to a healthcare system. You don't realize it, but the employee turnover in healthcare is very high. There's a constant influx of new employees. Some of these employees have had no cybersecurity training at all. And there's a lot of IT devices that are targeted. People's smartphones, the workstations in the clinics. A lot of doctors do business now on tablets, patient monitors. And then there's the interconnection. Your health records, all the electronic health records are dependent on lab information systems. And those information systems are dependent on a network connection to a lab analyzer system so that the results can be processed. There's a lot of interconnection between them. And it's the Northeast and it's allergy season, so I apologize. You know, there's so many different systems, X-ray software, emergency systems, pharmacies, patient records, all of that kind of stuff that is all dependent on one another. So what we concluded was that increasing the number of phishing campaigns that we'd send out equated to a decreased odd of clicking on a link or opening an attachment. And that seems reasonable, right? That seems almost, you know, like a no-brainer. But during the same time that we were doing our research, there was an article that came out, and I think it was in the ACM, the and I'm a member, the ACM, and what they found was that what these people were seeing was that phishing emails, sending them out to test people does absolutely no good. And our findings, we had almost 3 million points of data, and we completely disagreed with that. Increasing campaigns, increasing those phishing emails to test your employees and let them know, look, you clicked on this email last week. It's okay, you didn't do any harm, but you have to be careful about what you're doing. And this all goes back to that system 1 and system 2 thinking. One of the limitations that we came up with was that we wish we would have had times of when people click. Did they click after lunch? Did they click on Monday morning when they first got to work? Did they click on Friday so they could take care of something right before they left? And we didn't examine those. So that's the end of my part of this presentation. So I'm going to turn it back over to Alex for any questions that anyone has. I'd be happy to talk about it.
Sure, and thank you, Dr. Corbo. There was some interesting stuff I learned listening to this presentation, and I've been working on this program for 10 years. Always some great stuff, but I guess that's because cybersecurity is always changing. But we did have one question that came through, actually quite a few. I'll take this one first. It goes, how much of the issue can be attributed to LOT devices since hospitals are filled with them?
So the IoT devices, I didn't study those. Those are more points of entry. But again, I want you to think about this. This is a people problem. And cybersecurity is responsible for this. So while the IoT devices and that kind of thing are out there, and they're points of entry, what you need to remember is that it requires a person to be doing this. So that's once they get into the network, that's when the cyber criminals can start doing their thing. But they need a person most of the time to let them in. So yeah, the IoT devices are, hospitals are filled with them. And so far there hasn't been a whole lot that has happened with them, but it's coming. It's absolutely coming.
Thank you for that response, Dr. Corbo. We have another question here. What was the most surprising thing you found in your research on phishing emails in the healthcare industry?
So there were a couple things. First, I was always under the impression, just based on what I saw from the other sectors, that people would be more likely to click on something that looked like it was a directive from their employer. And it was really directives from IT that garnered the most response. But one of the other things that kind of struck me was when we first got the paper done and submitted. There was a really big healthcare journal that said nobody's interested in cybersecurity. They wouldn't publish it because they said the content wasn't anything that they were interested in, or the people who work there. So that was, to me, that was really telling. And it's funny because I go back to the boards, the medical boards and that kind of thing, and they're the people who are making the decisions, and it's up to us as cybersecurity professionals to be figuring out okay, how are we going to fix this? What are we going to do? What are we going to do to fix it? And the people who are on a lot of medical boards aren't interested. So for example, if you, would you want to be treated by a doctor who said, who cares if somebody gets into the x-rays? If somebody breaks into the server that houses all of the x-rays, who cares? It's just pictures of bones. And that's more than a quarter of healthcare providers who believe that, who don't understand that, yeah, if if I can look at x-rays, I can look at a lot more stuff.
I agree. Thank you, Dr. Corbo. I've got another question here. With the pandemic concerns, do you see more breaches increasing over time?
Yeah, absolutely. You know, it's funny. I go back to that saying, there's honor among thieves. And I remember when I first read on one of the chat forums that the cyber criminals decided that during the pandemic, they weren't going to send any phishing emails that were related to COVID. So they said, you know, it was almost like it was an honorable thing that they were doing. And I thought that was quite strange. But yeah, there's going to be more, especially since now we have so many people working from home. And if you think about your home network, remember the picture I showed about the, you know, with the dirty, polluted lake. That's pretty much what your home network looks like if you have teenagers. I can tell you. I can tell you from experience. Um, I, you know, maybe you're the exception, but I can tell you that all of the things that the kids do online, they have no fear. And a lot of parents, it surprises me, the number of parents who say, oh no, you know what, I just needed a few minutes. I let I let my kids play with my work laptop. They played a game on it. They installed something. Now it doesn't work. Those kinds of things will happen if the employer isn't doing anything to protect the systems. And we need to be doing more of that. We need to be able to, you know, and that's again, it's where cyber comes in. That's what we do. That I always say that we're largely a people problem. We're taking care of technology from a people perspective.
I agree. I agree. Got another question coming in. How effective is our cybersecurity program strategy at addressing these types of risks?
Well, if it depends if you're looking at the graduate or the undergraduate program. I mean, they're both completely different. From a graduate perspective, what we're really trying to get is leadership. We want leaders in cybersecurity. So we talk about this kind of stuff all the time. From an undergraduate perspective, we're teaching you the different tools and that kind of thing to use to protect the network. Where at the graduate level, you're taking those tools and you're implementing them. You're doing that kind of work. So it depends on if you're looking at it from an undergrad or a graduate perspective, but I want you to look at it as a leadership role in the workplace. I want our graduates to be leaders.
Thank you for that too. And we're coming up close on our time, Dr. Corbo. I wanted to see if you had any closing remarks before we're closed out today, and I'll answer some of these other questions from folks later and get them sent over to the admissions team. But did you have any closing remarks you wanted to add for tonight?
So I guess what I'd like to do is just really quickly tell all of you that I think I was 40, I think I was 40 years old. Oh my God, how time flies. And I was working in human resources. I was an HR director for General Motors, and I really didn't like what I was doing. And I went through a cross training program and started working with the IT department, and I loved it. And what I decided to do is leave my job that I made good money at. I had a company car. I was really happy, but I really liked doing the IT stuff. And I eventually left that job. I went back to school. I went to Utica College. I ended up, getting my undergrad degree, and then my master's, and eventually I went to another school, got my doctorate, and it was the best thing that I ever did. I love our school. We're NSA certified. We're a center of academic excellence. Our forensics program is one of only 11 in the country that have the DC3 certification. But it really is a game changer, and it is a lot of work, and but nothing that's good is ever easy, and it's hard work, but the rewards are fantastic. This is probably one of the best fields to be in right now because it's growing. All of these sectors need a lot of people. They need people. You probably see the reports about how there's so many unfilled positions because there aren't enough qualified people to do it, and we're creating those qualified people.
I would agree. And I've seen a lot of them come through here. And
Me too.
it's amazing. It's truthfully amazing. And
Yeah.
I'm proud to be a part of this institute, as I'm sure you are too, Dr.
Me
Cora.
too.
Yeah.
Me too.
We're seeing a lot of great things happen, and we'd love to see more happen with more candidates come through the program. For those of you that weren't able to get to your questions, please do reach out to our admissions team today. The contact number is right there in front of you. You can also reach us or visit our website to explore more about the programs that we offer in cybersecurity and some of the courses in detail. And we're always here to help in any way that we can. And Dr. Cora, I want to thank you again for extending your time this evening to share this information with some of our candidates that are looking to go through the program. And this has been recorded, so we'll get this sent out to those who weren't able to attend as well. But definitely want to thank you for your time, and everyone else for spending your moments with us this evening.
Thank you.
Everyone have a great evening.